Hi, this is Dr. Sora, and we're here today to talk about STIs that are quite common and quite prevalent.
Hi, my name is Kata, and I am currently a student at Florida International University, and I'm studying psychology. And I'm here partnering with Dr. Sora to talk about STIs and STDs and just different infections and diseases that can be sexually transmitted. And we just want to make sure that you're aware of them. So then, if you know someone or you or yourself happens to go through having a phone call about being told that the recent partner that you were with has an infection or disease, you know how to respond to it. So without further ado, Dr. Sora, if you want to start us off.
So what are STIs? They're sexually transmitted infections. They're passed from one person to another through sexual contact, and it could be vaginal, anal, oral, sex, and sometimes it's just skin to skin contact. They can be caused by bacteria, viruses, or parasites, and they don't discriminate. Anyone can contract a sexually transmitted disease if you are sexually active. And one thing that's important to know to start with is three major types of STIs: bacterial STIs, chlamydia, gonorrhea, syphilis are typical, and they are curable with antibiotics, especially when caught early. Left untreated, they can lead to serious complications, including infertility. Of viral STIs like HIV, herpes, HPV, and hepatitis B have no cure, but they're manageable. Antiviral medications and treatments such as ART, that's antiretroviral therapy for HIV, and PrEP, pre-exposure prophylaxis, can reduce symptoms, lower viral load, and dramatically reduce the risk of transmission. With HIV, it's like miraculous that that these drugs have been invented since like the 1980s can prevent someone from getting HIV. That's what the PrEP is, or they can prevent someone from spreading HIV, and that's what the antiretroviral therapy is. The problem with that is people who are on these drugs may still be susceptible to bacterial infections. The HIV drugs don't cure everything or manage everything, and that's something that people need to take a look at.
We mentioned the bacterial and viral ones that you had recently talked about. I wanted to mention some symptoms that can be linked to these. So, a lot of times, chlamydia and gonorrhea are the ones I hear the most about in this day and age. And the common symptoms are usually asymptomatic, but you could also be seeing discharge, burning urination, pelvic pain, and also even sore throats because you can get in your throat from oral. And a lot of the times with syphilis, which is a little less common, you see sores and rashes on your palms and soles, usually the latent stages. As Dr. Sora was saying, luckily a lot of these are treatable if treated early on, but if not treated early on and ignored, it can actually cause infertility at most, which is pretty serious. So you want to make sure that you take advantage of knowing about this as soon as possible. And then with the viral diseases and infections, a lot of these are a lot more serious and you usually get symptoms more similar to fevers, fatigue, swollen glands, painful blisters, sores, even warts as well. A lot of these can just seem a little more extreme. There have been a lot of cases where you see bumps or unusual looking rashes on the genital areas, which can concur you to assume that you have an STD, which is why it's just really important overall to get frequently tested, which is one of the most important preventative measures when you have a lot of different sexual partners, as well as the fact of you being sexually active. Because if you're sexually active with one person, you don't know if that person could be sexually active with multiple other people, which is then when the chain begins, because what starts with one person and then it spreads out to multiple, and those multiple then multiply. It's like when people give birth and then the others give birth, it's like a cycle. So the way to prevent that cycle is by making sure that you get tested frequently, having communication with the partners that you have sex with, and also just making sure that you use preventative measures such as condoms and dental dams, which are used more for oral. It's like a little thin paper that you can put on top of the genital area, which will prevent you from getting any STDs or STIs. To cover the parasitic diseases and infections, so we have trichomonasis, pubic lice, which is also known as crabs, and we have scabies. So with the first one that I mentioned, it's going to give you within symptoms a frothy yellow green type of discharge color. It also may give you itching and odor. And then with crabs, you also have itching. It's more of like a common trait. With parasitic, you just have a lot of itching down there, which isn't really common. With crabs, it's just a little more visible because you can see normally the lice or the eggs in your genital area. And with scabies, kind of like remember scars, scabies, they both start with ska. I like to think about that because it helps me remember that they both give you like rash-like little red bumps, and itching, like I mentioned earlier. I know some people in general have slight itching sometimes. That doesn't mean you necessarily have any STI or STDs, but it's always important to check up with hygiene in those cases and, just get frequently tested, like I mentioned beforehand, so you can make sure you avoid having any of these. But I'm going to pass the mic to Dr. Sora so she can talk to us a little bit about the consequences and different things about them that I didn't cover.
And for bacterial infections, if left untreated, and that's why you need to get tested frequently, or if you have any kind of symptoms down there, you have to get it checked out by a doctor because these spread really easily. And not just the bacterial infections, which can be cured with antibiotics, but viral infections as well. And that one, the HPV virus, long term, if left untreated, STIs can lead to things like infertility, ectopic pregnancies, pelvic inflammatory disease, which is an infection of the uterus fallopian tubes, and it could cause chronic pelvic scarring. It can cause cancer. It's recommended now that teenagers get vaccinated with something called Gardasil, and that does prevent certain strains of HPV, but not everything. With bacterial infections, they are curable. And then with viral infections, they never go away. And I know people who've had contracted viral infections and they suffer. My point, these things can lead to serious diseases. Right now, we're talking about infections which are curable or manageable. I'm going to, make this point again that a lot of people don't know that they have these diseases, so they're transmitted. Especially for women, this is really important because you might not feel symptomatic at all for like a couple of weeks, and by the time you do feel symptomatic, you're already infected. You don't know it, and then you'd have more severe symptoms. How are these treated? Well, antibiotics for bacterial infections. Penicillin cured syphilis. Oh, one thing about syphilis, for a while, that was the fastest growing STI. For HIV medications, you have to stay on it for life, ART medications. What I really want to talk about is how do you not contract? How do you protect yourself? Firstly, knowing that it's possible to get an infection, to really think before you're with someone, and you have to talk about it. My sex ed class, I asked, do you have these conversations about STIs or avoiding pregnancy? And what the student said was, no. For the most part, they don't have these conversations and they don't talk about getting tested. So if you are sexually active, here's some conversation starters that you can try with a potential partner. And you can say something like, before we get intimate, I want us both to feel safe and informed. When was the last time you were tested for STIs? Would you be open to sharing your results or even going together? You can also ask things like, have you ever had an STI? Are you seeing anyone else? What kind of protection do you use? Being clear doesn't kill the vibe. It builds safety. If someone reacts with defensiveness or refuses to talk, yeah, that's a red flag. Some studies that were done that talked about, 1 in 5 people in the US had an STI. That's a lot. Be mindful of substance use, which can lead to risky decisions. If you're at high risk for HIV, talk to a provider about PrEP. In order to take this pre-exposure prophylaxis medication, you have to not have had HIV, so it prevents you from getting it. And then, most importantly, communicate with your partner. Honestly, it's not anti-romantic, but it sets up trust. It sets up uh, being able to have more fun if you're going to have sex. It's something out of your mind and you don't have to worry about.
I think that sometimes people can feel a little awkward talking about these things as well as just overall using protection. Like we talked about in our previous video, contraception. But I think that the best way to approach this is not really thinking about how you'll look to the other person, but the things that you're preventing, because at the end of the day, this is your health, which is very important, obviously, because, you may think in the moment like, oh, sex is fun. I just want to have sex and I don't want to worry about anything. But it's going to cost a lot if you think that way, especially considering the fact that all of the viral diseases that we talked about today usually can be manageable, but they aren't curable. The parasitic and the bacterial ones are curable with antibiotics and different treatments. But the viral infections like HIV, herpes, HPV, and hepatitis B, they are not curable, but manageable with medication, lowering viral loads. But just to give you an example of HIV, if you let it spread your system without taking care of it, you could develop AIDS, which can then seriously harm your health and your overall immune system, which is just,
And kill you.
yeah, exactly. And cancer as well, like you had mentioned earlier, that can definitely kill you, like it has with a lot of people, unfortunately. So it's just something that you want to take into consideration before having these conversations. I think the best way to mention it is possibly mentioning that a previous family member or friend of yours suffered or suffers currently with a STD or STI, and you want to make sure that before getting into that same situation, you want to get tested. So if you start something like a new relationship with a partner and you guys are having conversations about, maybe having sex soon, maybe it would be a good idea to get tested together. So it seems more of like a, hey, let's do this like together because let's just make sure we're both okay. Not like, oh, I don't know if you have something because I don't know where you have been. Instead of making it seem like they are the problem, make it seem like, hey, let's figure this out together and let's both be adults and make good decisions.
If you have contracted and you find out you have an infection or virus or parasites, let your partners know. It's cruel to not let them know. And there are people who do that. In my classes, I use this chart, a why people have sex chart or a study. And it's a questionnaire, 150 something items questionnaire about, why people have sex. And one reason people have sex, revenge, it's wanting to give someone an STI. How are there people who want to do this? And there are. There are people who maybe they're narcissists, for whatever their reasons are, they want to transmit diseases to people. It sounds awful. It sounds scary. And when you're intimate with someone is to be vulnerable and open and not worry about anything. A recent study of commercial insurance claims found that from 2020 to 2023, STI diagnosis among adults aged 65 or older rose by nearly 24%, the largest increase among all age groups. Senior citizens, who grew up in the 60s aren't using protection, and they're more likely. That's, the fastest growing group for, transmitting STIs.
Just to go back to it, it's important to get tested frequently. Make sure you speak openly to your partners about your history as well as theirs. And just keep in mind the preventative measures that we mentioned so that you can avoid these infections and diseases for yourself and your loved ones. Other than that, if you have any questions or you're interested in any other topics that are related to our content, please write them in the comments down below so we can have more ideas for content to make. And leave a like and share with a friend who may be interested because truly this content is relatable for anyone who is actively having sex.
When I thought that I wanted to do a podcast about this, it just occurred to me that most people have not had any kind of adequate sexual education. And I'm grateful that I've had an opportunity to, talk, discuss, teach, learn about sex over the years. And I just think this information in a frank, down to earth, open way is just so important for everyone to have. If you're going to be sexually active, you need to know about how to avoid pregnancy, about how to avoid STIs. You also need to know about love and emotions and, culture. So, like Cara said, please, if you enjoy this episode, please like, subscribe, and share with someone. And good information is very sexy.
Exactly. We'll see you next time. Thank you for tuning
See
in.
you next time. Thank you. Bye.